Hi everyone and welcome to the Daily Blu. I'm Karin Caro and I'm here with a very, very important episode that can save you or someone you love's life. And I'm here with Dr. Grace. Thank you so much for coming today.
Thanks for having me
I mean, I feel that I've gotten quite an education in the last few minutes about something that can save people's lives. Dr. Grace is a family practice dentist and she has a product called Velscope that can screen for cancer. Very, 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 very important subject that you have here. So tell us a little bit about this product and what you offer.
So oral cancer screening is a very important part of a regular dental exam. And when since the oral cancer killing rate has remained the same, sadly, for the past 40 years or so.
The rate has stayed the same of cancer?
Exactly.
Oh my gosh.
And unfortunately, less than half of people made out the survival rate for past 5 years.
Right.
So it's becoming more and more, it's being more and more aware, brings more and more awareness recently.
Sure.
So what we do in the office is we, every time when a patient comes for regular checkup and cleaning, every dentist, including us, should be doing a basic oral cancer screening. That's a basic touch and see and feel. And we also offer enhanced oral cancer screening, which nowadays, luckily, I am happy to say is very easy with the Velscope machine.
So the Velscope machine is, show us, Dr. Grace.
Okay.
If you have a patient in your office and who do you ask to get the screening, by the way?
The screening is being done nowadays for anybody. We offer to any patient that's over age 16 and up.
Okay.
And because of different risk factors nowadays we have recently discovered.
Sure, so
right.
Any age, well, over age 60, but if you see something, you have explained to me that if you see something that it might be off, you are suggesting that they do this.
Absolutely. If there are people that normally don't want to do the test, but we see something that's not so great at naked eye looking at it, we really, really would love to do that versus the scalpel biopsy, things like that people really want to shy away from traditionally.
Okay, so show us how it works.
Great.
Let's see, if I put my hand out and this was my mouth.
Right, then with the naked eye, I'm looking at the top cell layer normally inside the mouth. So let's say if this is skin inside the mouth, then that is what we normally see. And unfortunately, oral cancer usually starts at the basal cell layer.
Okay.
And therefore, that's where the Velscope machine comes into play. It really, as a patient, all you feel is a little bit warm energy, and you definitely don't see, but what is in your mouth, but normally we see that blue light.
Okay.
And what I'm able to see as a clinician is when I look through that, there's a greenish, bluish field that to show me what the basal cell layer actually look like.
Okay.
So basically, it allows us to catch precancer cells, a precancer cellular change on that level, or catch hopefully oral cancer at stage 1, very early stage cancer, which drastically increase the survival rate and also makes the treatment so much easier to endure and go through with a much more success.
Right, you don't need to scrape anything. You can take this machine and you can actually see the layers of the skin in your mouth to detect cancer all the way, I mean, down to your jawline? Or
well, it's as simple as goes. Let's say if the skin has a top layer, middle layer, and a basal cell layer. Then it's your blood vessel, your nerve, and all that stuff, the dermis underneath there.
Right.
So this one, oral cancer starts at the basal cell layer usually. And unfortunately, without the machine, or without other kinds that have done in the past, normally we wait in order for us to do oral cancer screening and actually see the changes. We basically wait for the cancer to occur and grow and then grow and then grow to a top layer. Then we say, oh, sir, I think something doesn't look right.
Cancer.
Yeah, let's do something about it. And usually catching at a late stage, therefore contributing to very uncomfortable treatments and then very low survival rate.
And if you have any signs of oral cancer, that can lead to other cancers and spread throughout your body, right?
Absolutely. Like your body's connected. Your mouth is your jaw is connected to the rest of your body. Just like a lung cancer can spread to other place, oral cancer can spread down. I had a cyst the surgeon that completely flap the chest completely open, looking for lymph node. The standard is to keep going until you find no more infected tissues there.
Okay. What are the results of if you do have oral cancer and it hasn't been caught? Are you subjected to any other certain types of cancer? Something like
any molecular cancer can spread just to any other part of the body.
Right.
And recently, my own OB doctor had talked to me about it. They are trying to raise awareness of the HPV virus vaccines,
Right.
because HPV virus vaccine, HPV virus infection is actually one of the newer risk factors that's playing into the oral cancer.
starting point. It starts
Exactly.
there,
Yeah.
and that's wow.
And that's why people are getting screened at age 16 and up nowadays.
Okay, so as a dentist, and you're a family dentist practice
Right.
located in East Norwich, but you take people coming from all over.
Of course.
And obviously, not every dentist has this. So, are you seeing that you'll have to treat other dentist patients because you have this service? I mean,
We're happy to help patient out. We, along with Nassau County, for example, Nassau County Dental Society goes out to do free screening.
good. Do you take this machine with you for that type of screening?
Luckily, yes, we do.
Wow.
We do. Yeah.
That's remarkable.
Yes.
And you could take
And-
this on the go, and you don't have to be invasive in any way.
Right. And
That's
then a
remarkable.
couple years ago at a local health fair, I was there and we screened people right off the street. Recently at a local laboratory, we screen patients. They come through. It's very non-invasive, very easy. It takes less than 3 minutes to do.
And you
and
see
you
it
got
right there.
instant
Instant
answer.
results.
Right. So no more
There's
losing
no
sleep.
waiting and losing sleep. Yeah,
Yes.
that's what I was just going to say. I mean, that is remarkable. And this can save you or your loved one's life by
Yes.
just uncovering what the cells are at the bottom and being preventative even.
Absolutely.
Okay, so tell us, if you see something in someone's mouth, what are the next things that they can do, and what are you going to suggest for them to do?
Depends on what it is.
Okay,
First thing first, if it's something that I don't think is a cancerous cell, make sure I let my patient know, don't panic.
Okay.
And I bring them back in about 10 to 14 days. Generally, any oral lesion in the mouth goes away after 14 days.
okay,
And that's if they don't go away, we look for reasons that may contribute towards that, make changes. on
Okay.
that. And that's if it is something I really think is bad. There are certain lesions I know is bad. I connect them
You
with
can
an oral
tell.
surgeon,
Okay.
a surgeon that can treat them right away, and we literally hand them a phone and make their appointment right there. Short of driving them
wow.
to the office.
Well, I know you personally as a person that really cares about your patients, so you're suggesting many of your patients to get this service because you have it, it's available, it's easy to do through your practice, whether they're over 60 or not. You'd like to be preventative. Is that
Right.
the case? I mean, that's-
Absolutely. Anybody over 16 and older should be getting the
Wow.
screening.
Unbelievable. Dr. Grace, how can people get in touch with you to make sure that they're using this?
You can call us at my office number, which is
Okay.
516-922-5740.
Good. And or they can reach you on your website, which is lidentalspa.com. That's lidentalspa.com. Dr. Grace, thank you for this valuable information today that you've provided. I know that you are on a mission to help people, and I greatly appreciate that. Please get in touch with Dr. Grace, even if you need help, suggestions, advice on how to make sure that you are being preventative in getting certain cancers that start with oral cancer.
Yes.
Thank you very much for joining us. I'm Karin Caro with Dr. Grace Hsu on the Daily Blu. Thank you.